Armstrong from Get Well UK. We're trying to make complementary medicine free through the NHS. It's really important to find out whether or not these therapies work and if we should spend public money on them. So I'm off to Exeter University to meet Dr Charlotte Paterson, the inventor of MYMOP, which we think is going to help us answer this question. So what is a MYMOP? So, what is a MYMOP?
A MYMOP, well, it stands for Measure Your Self-Medical Outcome Profile, and it's a very brief questionnaire which helps patients to say what their main problem is and to score how bad it's been in the last week. And then when it's repeated over a period of time, we can see what change there's been in the problems that they've got.
Okay. How was the MYMOP developed?
When I first worked on MYMOP, I was a GP in Somerset. And then I've gradually come to do more research and less practice. So I left practice about 7 years ago. I did an MSc, a PhD, and now I'm a full-time senior research fellow here at Peninsula Medical School, University of Exeter.
And why did you create MYMOPs?
Well, we wanted to evaluate what was happening for patients going to see the complementary practitioners there. And when we looked around for a suitable questionnaire, although there were absolutely hundreds of them, and there are now thousands of them, there wasn't anything which was really patient-centred and which was really brief and that we felt would capture the patient's perspective and change over time. So we had to develop it because there wasn't what we wanted. Luckily, I didn't know much about anything at that stage, so I didn't know how difficult it was, so I might not have started. Doesn't matter whether it's an orthodox practitioner, a psychologist, a complementary practitioner, because MYMOP puts it all into the patient's words, then we don't have any communication problems because we just go with what the patient calls it.
Are there symptoms or conditions where MYMOPs aren't very effective?
Yep. They're not very effective for episodic conditions because it asks over the last week. So say something like migraine, menstrual period problems. If they only happen like once a month or once every few months or 3 weeks, then it's not a very good method for anything that just comes and goes like that. Obviously it has to be a problem with a symptom. And certainly in general practice lots of people come for help that isn't necessarily related to a symptom.
You include a question about medication?
Yep.
Why is that in there?
When I was doing these interview studies with people, and I was interviewing them before they had treatment and after they had treatment and finding out from their stories what the main things were that were important to them that were changing. And we were capturing quite a lot of that on what they'd written on their MYMOP, so changes in their symptoms and so on and so forth, and their well-being. But one thing we weren't capturing was medication. Particularly for complementary medicine, a lot of people go to acupuncture, for example, in order to cut down their painkillers. That's their number one, or their steroid inhalers or whatever. So for them, that's a really important outcome.
And how do results get analysed?
No, I mean, it's very simple to analyse. It's got 4 sections to it. Symptoms, 2 of those, activity, well-being, and they're each on a 7-point scale. So we're not talking complicated numbers. So we can analyse each one individually. So if someone scores 6, which is very bad, the first time, and then they score 4 the next time, then the change is 6 minus 4, which is 2. And if you've got a group of people, you do that with a kind of average and mean and so on, as statisticians do. Or you can do the profile, which is just the average across all of them. So that means adding up the 6 and the 4 together and dividing by 2, which makes 5. So yeah, even when you use all 4, it's not very difficult.
Great. And why is the scale 0 to 6?
Well, there's lots of arguments about how long you should have a scale. There's quite a lot of 7-point scale questionnaires, health questionnaires. So it's in a group of 7-point questionnaires, which is helpful because you can then compare with other questionnaires.
What change should people be looking for?
The work that's been done with other 7-point scales suggests that a change of probably about 0.8, but certainly 1, is what we call a clinically significant change, is a change that's worth something to the person involved. And that would also go along with the work we've done with MYMOP. So we have done work to also ask people in other ways whether they thought they were better. So yeah, probably a change of 0.8 or more, but if you want to be simple, maybe 1.
How do you find out if someone's willing to use it or not? And how would you do that in a consultation? Would you need to ask for their permission before?
MYMOP itself is just a tool, so it doesn't have a consent procedure attached to it. If you're using it in a research study, then obviously you'd go through normal research procedure consents. When we say whether it works or not, first of all we want to know whether it's kind of feasible and applicable, whether people can fill it in reliably and so on. So all that seems to work quite well. We've also tested whether it detects change over time, which is really what the purpose of it is, and it is very sensitive to change. So we've compared it with other questionnaires and so on. It was much more sensitive to change than SF36, which you would expect because SF36 has all sorts of things in it that don't change, as well as the one little thing that does change, whereas MYMOP is problem-centred, so it only measures the thing that does change. So it's much more sensitive to change than SF36, and it's being compared with other, the Euroqual, it's more sensitive to change than Euroqual, and it's filled in more completely, again, because it's kind of simpler and so on. So yeah, it performs quite well compared to other scales.
So you've done studies on this? Have they been published? Where have they been published?
Yeah, the first one was back in '86. That was published in the British Medical Journal, and then I've done another 2 or 3. Quite a few of them, as time's gone on, I've done ones where I've interviewed patients so I can detect what their main problem, what they say their main problem is just in an interview, and then checked it out against the questionnaire to see if it makes sense. And then some other people have done some studies on it as well.
And what's your hope for the future of MYMOPs?
It's got its niche and it's used, and I think it will go on being used in certain service evaluations, but in the research world more generally, we're still using huge numbers of tools which are designed by researchers or practitioners or whatever, and then the patient fills them in, but they're not really allowing the patient to say what the main problem is. So, my hope would be that from the idea of that, and there are other tools around, there are a few others, that set of questionnaires will grow.